Good afternoon, everyone. This is Karen Cole from All Chicago, and I'm back. A couple weeks I wasn't here with you, but I'm back to talk about today's topic, which is going to be the accountability plan that was drafted. So sorry if you were expecting something more um, sharing of best practices and stuff for this week. That'll be back next week, though. For the housekeeping, we like to keep everyone muted on this call until we have discussion points. If you're on the phone, please just hit *6 to unmute yourself. If you're having trouble with the audio, we do recommend that you use the phone instead of the computer, but whatever works for you. We do use the raise your hand function, so you will see a little button with a little hand if you want to be unmuted for any reason, and the team of Jennifer and Bridget and Torlin will work hard to unmute you to ask a question. And then of course our primary means of communicating with each other is the question or the chat box near the bottom of the side panel. So please feel free to put any questions, comments, chat items in there. And again, Bridget and Jennifer and others are going to be responding to those. So again, like the main goal of this is really time for you all to share questions, strategies, and resources. We do find it's a nice space to like talk to a lot of you at once and let you know what things are happening. And it's also a way to work towards solution and a common understanding. So that's really the goal of today. So we, as part of the expedited housing initiative that the brief was released about a week ago, recently there was an accountability plan passed, and we're also going to give you an update of how there's some slight changes to coordinated entry that will help us house folks faster. So I am your host and presenter on the accountability plan. And then our amazing Stephanie Seidman from CSH is here to talk about coordinated entry prioritization. And then All Chicago's own Bridget is going to talk about coordinated entry interim policies. Okay, so I'm going to just review the expedited housing initiative quickly. So as many of you know, the board at their meeting in the middle of April endorsed a series of adjustments, also could be called reaffirmations, that will influence the system and allow us to house folks into permanent housing more quickly. We want to remain nimble during this health crisis, and we believe these adjustments are a way to help us do that. So All Chicago is, as always, is helping facilitate the system and providing and for the system adjustments as well as the provider adjustments. So for the system adjustments, again, apologies, this is probably reviewed numerous times for some of you since you are regular attendees of our webinars. So All Chicago, as far as system adjustments go, the leads for this is All Chicago, CSH, and the Center for Housing and Health. And we're utilizing our regular implementation structure with the help of different city departments to do a few things, right? We're working on, and Stephanie will give an update on, of temporarily changing the coordinated entry prioritization and making matches faster. All Chicago and CSH are doing a lot of work on system-wide landlord engagement so we can move folks really quickly into new units. And then we see that rapid rehousing or bridge, really temporary short-term housing solutions are going to be increased in a way to quickly move people into a home instead of being in a hotel or in a shelter and then moving them on to a more permanent solution or working towards a more permanent solution. And we are, as you know and have heard over the last numerous weeks, we have been doing a lot of reducing system-wide barriers to housing. As far as provider adjustments, this webinar and lots of other things are seen as technical assistance and guidance and making sure folks are accountable in the areas of this plan. So Many of you have notified HUD and are using waivers to bypass some of the regulatory requirements to ensure quicker housing. You've been working really hard to waive any non-regulatory housing and documentation needs, and then identifying ways that you yourself can connect to the system, this system-wide effort. I just want to add to, this isn't really a provider adjustment, but as a system, as a reminder, we are trying to get others, CHA, the trust fund, IHDA, to reduce some of their barriers too. So if there's a barrier we haven't recognized from folks we haven't recognized, just feel free to reach out if there's something we can do to advocate on your behalf. So as part of the policy and the request of the board was that there would be an accountability plan put in place with the community, so we know that people are making their best efforts to house folks quickly and reduce barriers. We released we sent an email to everyone on Monday, and the start date is going to be May 4th. So we're giving you kind of this week to digest that. So it's going to outline how we measure adherence to the expedited housing initiative. And because this is a performance related function, we went to SPEC, the System Performance and Evaluation Committee, and worked on this with them, and they approved it as the leadership over performance data and research. So you'll see that the accountability plan, which I'm 90% sure is a handout, it's that first PDF, accountability for expedited housing, has two sections. One section is on expectations and the other section is on the accountability piece. So we have different sections of what these expectations are. So actually, when we first started talking about this with SPEC, one of the main things people said was like, these don't seem like new expectations. So I hope that they will not feel like new expectations to you all. It may just be that they're framed and talked about in a different way or highlighted more than they normally are. So the first is, of course, waivers and record keeping, right? With the idea that the policy itself encourages people to reduce barriers, using the HUD waivers to expedite your housing. We've provided a lot of guidance on this already. We have the interim record keeping we have a variety of webinars, and we are always here, some of us until late in the night, to help with any questions. So if you have a question outside of any of these webinars, just email cocprograms@allchicago.org and a member of the team will get back to you quickly. So for coordinated entry, so one of the things in the plan is that the expectation is people don't hold vacancies, especially for isolation or quarantine. Like we have heard that some folks are considering doing that with their units. We ask you not to, because really housing folks and giving them a home really is the best method of safety and public health. We do request that again, this is just reiterating, request a match within 2 days of a new vacancy. So if you know someone's exiting, on May 5th, please make sure you have that request in by the 2nd. If you know earlier, like you can always request a vacancy earlier than 2 days as well. I'm going to turn it over to Bridget, and she's going to run through the interim policies, the coordinated entry interim policies and procedures, which is also in the handout section. It's actually called Housing Provider Interim Contact Protocols. So Bridget.
Thank you, Karen. Hi, everyone. I'm Bridget Doviet. I'm a senior program coordinator at All Chicago, for those of you who are not familiar with me. So I will be going over just kind of the back of the envelope changes that we made to our interim housing provider contact protocols. And I switched those words around, so in the handout, you'll see it all straight. But we've moved from 10 days we've asked people to attempt to contact, and we've gone to 5 days. So we've cut that in half. We've gone from, we were asking housing providers to try for 2 occasions of contact during that attempt instead of 3. And we took out the mail option for contact because we realized cutting that in half, it's kind of not productive to ask people to use the mail. We still have the 90-day re-engagement policy. So if you're attempting to contact them, then you can, sorry for a second there. You can still, if you're attempting to contact them and you don't reach them in the 5 days and they show up again, I'm realizing that this is not forwarding on here, so I apologize. Karen, do you think you can put the PowerPoint forward? Thank you.
Sorry, I didn't realize you added more slides. So just say next slide and I'm with you.
Okay, great. So we can probably go to the next slide. So, oh, well, this is the prioritization plan. This is Stephanie's part. So if we just go, yeah, here we go. So 5 days, there we go. Next slide, please. Next slide. So you can see here we're talking about the 90-day re-engagement policy, which we've always had, but we just outlined that more. If you still have capacity to take that match, if somebody does contact you within 90 days of the original match capacity, then you can ask Catholic Charities to rematch that household or individual to you with no problem. Households who cannot be contacted or located on 2 consecutive occasions will not be matched again until they have an updated HMIS. That is not something new. Next slide, please. And so new things that we added are if there are households that are enrolled in projects that offered scattered site housing, they can up to 3 housing options. After declining these 3 housing options, they will go back to the matching list unless they have identified their own unit. Households being transferred through the coordinated entry system can deny up to 3 housing opportunities, and after these 3 housing opportunities are denied by the household, they will not be considered for a further transfer. That is not a change, but we just wanted to outline it in our policy. And something that is new is declining SROs. Households that have declined SRO housing twice will not be matched to an SRO in the future, including SRO housing that includes a bathroom and or a kitchen. So next slide, please. So with the timeliness standard, it used to be for housing providers, we asked you to update the interim update in 30 days, and now we're asking you to do that in 15. So from attempting contact to next slide, please. One of these. So the timeliness standard itself, asking you to change the need status to one of these, that stays the same. We're just cutting everything in half, basically. So we're doing in 15 days instead of 30. You're going to change it to one of these. We realize that we're not asking housing providers to house participants within 15 days. So we will go to the next slide. So then you can see that we will change it for you just like we used to with 30 days, and the household will be placed back on the 1 list. And then we will also send you a new match at that time. You will get the emails. Those will start up again as they had in the past to let you know that we are going to be changing that need status and sending you a new referral. Next slide, please. So if after 15 days you've changed it, you have another to like engaged, in progress to enrollment, enrolled, or one of those, you have another 30 days to resolve the need status. If you need an extension, because we do realize that those things happen in housing, right? You can always email Catholic Charities and myself, bjoviet@allchicago.org. So the referral need status will not be updated by anyone other than you, the housing provider. We just want to know in the email what the reasoning for the extension is and an estimated timeline, which can be flexible on a case-by-case basis. We're not going to hold you to that timeline. If you need more time after that, just feel free to keep on communicating with us. That's the whole name of this game, is communication, because everything is changing on such a rapid basis. So we really appreciate you guys being flexible with us, and we're going to be flexible with you. Next slide, please. So then I just have a little bit to say about the expedited housing policy information for housing providers. This is all on your slide, but Our goal is to house individuals and households in the least amount of time with minimum barriers to housing. And I know you're like, yeah, that's always been the goal, Bridget, but now we just start really like on it. So we want housing providers to remove barriers and really just go for that HUD waiver and lean on that for documentation that is not obtained during this interim period. Next slide. So there's no change to your eligibility criteria. You should use, oh wait, is this not me? No?
I can take this one.
Perfect. All right, so that's my piece. Thank you for dealing with the technical difficulties. If you have any questions, put them in the chat box and I can do my best to answer them. Thank you all.
Great. I think I'm just going to pause here because we haven't had a moment for questions in a bit, and I see we have one. So let's answer that question quick before we move on to eligibility. So the question is, do we ask matches to identify an area? I don't know if Bridget or Stephanie, if you want to answer that one. Do I have to unmute somebody?
Yeah,
I'm no longer the host, by the way.
Sure. Yeah, I think I want to make sure I understand, but is the question if people are being asked within their coordinated entry housing assessment an area of the city where they'd like to live? Is that the question?
It sounds like it just says, do we ask matches to identify an area? Let's assume that until we see a little other note in the chat box about it.
Yeah, so our question specifically asks households where in the city they will not live. And then we do not match to project-based locations on that side of the city. So we don't say, what is your preference? We tested that question with veterans and 90% of people say the north side. We were not able to accommodate. So we just ask, where will you not live? But then of course, if it's a scattered site program, the conversation should come up again.
Great, thanks, Stephanie. And then we have another one that says, is the expedited housing policy that the board, I assume the board passed for TH, permanent supportive housing and rapid rehousing? Definitely for permanent housing. I mean, I would say with transitional housing, especially since we do kind of view youth transitional housing as something semi-permanent, like we would expect you to reduce as many barriers as you can. I don't have the policy in front of me to see if it explicitly calls out TH though. And then one more question popped in. So can we self-attest for income when SSA letters cannot be obtained online? So again, I mean, if you're using other funders, they may request you to have an income verification. Like generally for the HUD COC funding, that's not a requirement. So we have been advising folks to utilize the emergency record keeping protocols to document why income cannot be verified at this time. I think, and maybe Stephanie, you know, I thought maybe CHA was allowing folks to do self-attestation, but I don't remember. But generally, like if you can just use emergency record keeping policies, that should be fine. Okay, I don't think so. Stephanie's not answering. So the one more, and then we'll move on to eligibility. Maybe two, because now we're getting all the questions, which is great. So regarding eligibility criteria, if we are unable to access third-party verifications of disability and homelessness, should we move this person in regardless? And if we discover within the 180-day window that someone's actually ineligible for PSH, what was the potential consequences of that? So two things, and I hope if other people want to respond to this, they can. But one, with a disability, if your agency notified HUD of the waiver for disability, like you can just do self-certification for disability, and that self-certification from the client will hold for as long as they're in your project. So that's why we're highly recommending you do the HUD waiver, at least for the disability documentation. I mean, as far as homeless documentation goes, I mean, again, like we recommend using the emergency record keeping protocol to document your attempts and getting those. I mean, I think I would please reach out to us at All Chicago if you're feeling that you did your best efforts and then after 180 days they end up not being I mean, you're assuming they're not chronic, right? So if you don't think someone's gonna be able to document their homelessness at all, then I'm not sure you should enroll them at all. But if you're worried that you can't document the full time of their chronicity, I think document as much as you can and then have the person self attest to whatever's missing. But if it just is clear that they're not going to get to the 12 months, I mean, I think at this point in time, we have to do the best we can. And as long as you keep documenting it, I don't think HUD is going to come back and say something. And the other advantage we have of the system is that we all went to Dedicated Plus, and Dedicated Plus allows you someone who's kind of almost chronic. But if you have questions, just reach out to All Chicago, because that's a pretty nuanced thing that could be person by person. And then a couple more. If referrals aren't able to provide any proof of identification of self or family members, what can we do to house them during this time? So again, from the HUD COC program, you don't need proof of identification, but I know that many of you blend funding, especially if you're project-based, with other things. I mean, one, reach out to that funder about it, but again, the emergency record keeping protocol should help. We hope it helps you, and we've tried to reach out to other entities to say, can you set aside documentation? But there may be just some funding sources that can't. So yeah, I mean, lots of places don't really require ID. I mean, that's just, Stephanie, I don't know if you have any other insights about that one. I'm going to unmute you.
Oh, thank you for the unmute. Appreciate that, Karen. So I would say currently, you had asked earlier, CHA does not have a blanket statement out that people may self-certify on documentation. And what I have seen so far is that it's been advocacy one person at a time. And of course, All Chicago is and partners are engaging CHA at a system-wide level. But I have had at least a little bit of success with one person at a time. So if I can help anyone, and you could email me, I'll make sure my email's in the chat, the HMIS ID of someone without all their documentation who is stuck in a CHA process. I'm very glad to advocate for them. We have seen a few people get approved with things like a Social Security printout or something that would show the Social Security number, even though it's not the Social Security card. So not to the extent of no documents, but just not the exact documents has been working like that. And I think that's I'm so glad that people are raising this up. And Karen, that you said reach out to your funder as well, because sometimes I've noticed sometimes organizations are following the most restrictive rules when they are setting the rules in their IDA financed buildings, and can reach out to IDA, around tax credit properties and such, where the rules could be relaxed to some extent, especially if it's not a CHA voucher.
And just one last note about so some landlords require ID. I mean, unfortunately, if the landlord is a big building, like All Chicago is happy to advocate, or if it's another COC partner on this ID question. I mean, if it's a local scattered site landlord, I mean, those are some of the hard choices we have to think about right now, and be honest with the landlord of why you can't have an ID at this moment in time. And if there's other proof the landlord will accept. I mean, that's a lot of what I know Stephanie and I and Jennifer have been working on, with understanding what types of verification of ID are acceptable, right? And so like, is it a printout? Is it a photocopy? And then with the idea that when things open back up, we can get it. So like, I don't have a good answer for that one, but you know, again, and then again, like when, like there's a lot of things for ID, social security card, birth certificate, any proof of ID. I mean, it depends on the funder, and a lot of folks are able to take other types of ID, even though they're using, like Stephanie said, the most restrictive. Like IDA is clear in their TSP language that those buildings can take a copy of a verification of income that has a social security number on, though lots of places do not do that. So it's important to like see what is supposed to be possible. Like also medical cards, like a medical card is a fine point of ID as well, especially if it has someone's social security number on. So someone says they can't see the chat. I don't know if Torlin or Jennifer, if you can look into that. I think the chat might only be available to the presenters, but I don't recall. Okay, I'm going to move on to eligibility. We're going to do CE prioritization after we get through the accountability plan. But great questions, keep them coming. If we don't get them all, tell them now. I will follow up and talk and get responses for those. So moving on through the accountability plan. So, you know, for eligibility, like really there's no change in the eligibility criteria under this accountability plan. Again, use the waiver as much as you can for self-certification of disability. You can use lots of different types of remote contact to acquire third-party verification of disability or homelessness, really of homelessness. If you're still having trouble, you know, we know shelters are really taxed right now with everything they're doing. If something's not an HMIS, that is challenging to get to, but HUD has said over and over, like document your attempts, document your attempts, document your attempts, and then using that 100-day, 80-day window to the fullest extent. And then I have heard local HUD reps say that if you're getting close to 180 days, like keep them in the loop so they understand that you're still trying to get that verification of documentation, because it's not knowing how long this health crisis is going to last. Like some people may really get close to that 180. You know, we hope the stay-at-home order ends at the end of May, but if it isn't until the end of June, like those of you who started in, you know, early April with someone or the middle of April, like you're going to be hitting your 180 days really quick. So I always advise people to keep their HUD rep in the loop as well. So intake, of course, you know, the accountability plan, the expectations are you're removing whatever barriers you have in place that you can remove, right? So some of the things we've already talked about are intake barriers, requiring proof of identification as a barrier. You know, some folks are afraid to bring people in when they don't know whether they're positive or negative for COVID-19. I mean, honestly, that is another barrier with the fact we don't have enough testing. We can't, we should not be setting up that barrier for folks. Use the phone for intake. Lots of providers on other calls have told us how they're using the telephone to intake folks. They're using video chat, using social distancing. I think we're all experiencing this when we go out in the world, and we can try to use this in our own intake procedures, right? Like even at the post office, they have a piece of tape on the floor and they're not letting anyone get within 6 feet of people. So there's things we can do to ensure we're not coming into physical contact with folks. Video showings is a big thing right now with landlords. Again, I feel like a broken record on the emergency record keeping policy. But the main thing with intake is keep intaking folks during this time. We still need to house people. As regarding in the section regarding housing, again, we talked about using HUD waivers to expedite what you can. Look it through them. You don't have to notify HUD you're doing all of them, but you can, if you notify that you're going to use one, you don't have to use it, right? Like that's how it works. So relaxing FMR, 1-year leases for PSH or less than 1-year leases for PSH, HQS inspections for initials. And then we are working really hard at All Chicago to centralize the unit list. So if you're having struggles finding units during this time and landlords that will work with you, please reach out to All Chicago, and we will gladly share what's on our list and some of the landlords that we've been working with. Again, using technology creatively, have people send a photo of their signed document to you as a way to use technology creatively. And then, continue to inform us of other barriers from funding sources. So are doing a lot of different advocacy, and we're happy to add other folks to that advocacy. But again, we've really been focusing on CHA, IDA, and the trust fund in order to get a lot of these barriers reduced. So, as part of the policy, the board authorized the project prioritization work group, which has done the rankings in the past few years, to use it as a criteria, and that we want a demonstrated willingness and best efforts to continue to house folks during the COVID-19 crisis. We believe the best way to do this is through data. So some of the data measures we will be looking at, we haven't worked out all the details of it. We are committed to being transparent about it, and we're going to pull community members in to help to verify that these are the data points and there's a common understanding of how they're being pulled. So utilization rates, bed utilization rates, we do feel that if you're actively trying to house folks, that your utilization, should be consistent. I mean, it may go down for a little bit, but hopefully it'll go back up. Timeliness standards, so a lot of the things that Bridget had already talked about, how quickly you're updating data in HMIS, how quickly you're housing folks, so that review of the time from the match to housing will be part of that. And then whether you have openings without match requests. I mean, some of you may have gotten an email from the All Chicago team verifying your openings or verifying how many available, what your full stock is. So we want to make sure people are requesting matches and not leaving things open. The one other note on this slide I want to say is that spec was very they want the data to be only looked at from the period that we're talking about, right? So that period will start on Monday, May 4th, and however long we need this policy in place is the data period that we'll be looking at. We're not, they did not feel that it was appropriate to be comparing what you were doing 3 months ago with what you're doing now, right? Because so much has changed. So monitoring. So, when we come back out and monitor on site, who knows when that will be, we will look for how you were documenting and keeping track of things. So your waiver notification letter to HUD at the agency level, what support you used in those waivers at the agency level, and then your emergency record keeping policy and how you're noting everything in the client file. So as part of this process, everyone hopefully got an email on Monday who's on this call. If you're not, please check at your agency. And that we would like you to complete a little survey acknowledging that you received the accountability plan and understand it. This was one of the primary recommendations of SPEC as an easy way for us to be assured that everyone read it and understands it. And we just want everyone to read it, understand it, whether you have openings or not. We acknowledge some folks don't have openings and may not have openings during this period, and it may not apply to you, right? But we still want everyone to read it. If you haven't done that by May 8th, we will follow up with y'all and see what's going on. And maybe, there's a lot going on, so things get missed. We want to give you time in order to do this. It's a pretty quick survey, though. I'm just going to pause and answer some questions and such. So let me see. Where are we at? So no, we don't have a lot of new questions. So could someone, so someone asked for the HUD PDF file for the waiver for certification of disability. So again, just so everyone's clear, like we have a sample template on the All Chicago website to applying for a waiver. Basically, you're notifying HUD through a specific email, and after you notify them, you can use it within 2 days. And then there's the process of how to keep your documentation together. The next question is, I support the timeliness protocols. However, I'm concerned about using it for scoring because I've noticed several errors with HMIS not saving referral status changes. I don't know if anyone on the call can speak to that, but I'm happy to put a pin in that and talk to Beth about that if no one on the call knows. Okay, I got a couple more. Will our ATA be able to run reports in HMIS so that we can internally monitor how are you doing on the accountability standards such as timeliness? We'll definitely take that back to HMIS. We do want to get this data piece nailed down so people, if there is a report that we can make available to you, that you can run it as soon as possible. I think some of the timeliness stuff comes from what I call the back end of HMIS or SQL. So we'll have to talk about how we can make that available. I know Beth is really, we at All Chicago, and especially Beth is really committed to transparency and having you all have access to your data. So another clarification about waivers, that waivers need to be done on a project program basis, not on an agency-wide basis. So yes, you are asking for waivers for each program or project, but you only need to send one request to HUD. So in that request, you can list all of your projects and then you list all the waivers you want, and HUD is going to assume and rely on you to apply them appropriately. So if you apply for a waiver regarding the lease period being less than a year and you apply it to a rapid rehousing project, then HUD's going to be like, whoa, you shouldn't be doing that. So like you can send one notification to HUD, but like they'll rely on you to apply them appropriately. And then Stephanie wanted me to note for people before we move on to, I think a poll is next, if I'm not mistaken. That if you have, if you're a PSH provider and you have IDA or IHDA financed properties with low income housing tax credits, you should reach out to your IDA asset manager for support around documentation. Okay, so I think we just want to do one quick quiz about, one quick poll about the expectations here. And I'm gonna have Jennifer do that quick, and then I'm gonna actually have Stephanie go because I think she needs to pop off. So the question is, on a scale of 1 to 5, how clear are the expectations in the accountability plan? Very clear, somewhat clear, neutral, somewhat unclear. Sorry, I'm reading too fast. Somewhat clear and very clear. So if people want to vote, we'll see how that's going. I'm used to the good stuff being on top, so I keep looking at the progress and be like, whoa, that's not very good. Okay, so I think only half of you voted, but that's okay. Okay, I think, Jennifer, are you editing the poll for us? And there's our results. I mean, let's just do this last one, and then Stephanie, you'll be up. So what are the biggest challenges from your viewpoint? Revising your procedures, finding units, how data will be pulled, coordinated entry, or other documentation barriers. We can launch that one, Jennifer, quick. All right, we're at about 40% of you. It's fun to watch how the percentages have been changing. Probably give a few more seconds on this one. And so it's a lovely mix of lots of challenges. No one clearly being the winner. But coordinated entry was not the highest one, Stephanie. So I'm going to transfer it over to you, so she can talk about the temporary prioritization plan that the CE leadership put into place. Stephanie?
Great, thank you so much. Hi, friends. Stephanie Seidman from CSH. Nice to be with you. If you could go to the next slide. Want to spend a few minutes talking about the temporary coordinated entry prioritization plan. And this is hot off the press, approved Tuesday afternoon by the coordinated entry leadership team, to be implemented in early May. A new plan that's specific to our current crisis. And it's really important that we are calling this temporary and that we see this as temporary. The coordinated entry leadership team determined that they'll meet again in 2 months to review the COVID-19 crisis, data related to our implementation of this temporary plan, and to see what adjustments need to be made, and if this should be continued. It would be on a monthly basis. So just to say that we absolutely will come back to our coordinated entry prioritization when we can, but I'd like to now go through what we are shifting into. You can go to the next slide. So the primary population to be targeted, and this comes with a recommendation from the Chicago Department for Public Health, is households at high risk for serious illness due to COVID-19 and tested negative. So these would be people who, if they were to contract COVID-19, would be very likely to be hospitalized, would be at risk for death, and this type of group that's being tested and proven not to have this illness. Currently, many of these folks are in shelters and then being placed into Hotel 166, the shielding hotel, so that they remain negative. Certainly, the group is larger than that hotel, but just to give that as a current example. And the coordinated entry leadership team also approved 3 set-asides that will go into this temporary plan. One is already in place. Coordinated entry does offer 1 out of every 10 units or openings to youth, so people 18 to 24 with or without children. The 2 additional set-asides being added are 10% of units to be set aside for unsheltered households. This is recognizing that, at least currently, predominantly testing is taking place inside of shelters, even with the expectation that people who are unsheltered will be able to access testing. Really want to ensure that that there's a set aside so that if that is a slow rollout, or in any case, not up to pace, that people who are living outside are matched to housing, and a 20% set aside for families. The idea that families make up about 20% of the homeless population and should have a proportionate amount of housing offers. Within each of these set asides, there will be people who are in the first category of high risk for serious illness, and they would be prioritized. Uh, Also, as prioritizations go, it's not eligibility, it's prioritization. So there will be people in these three categories who are not at high risk and will still be housed as part of set asides. Next slide. So just to look a little bit into what we were offered by CDPH at Coordinated Entry and what our leadership team reviewed, when we say households at high risk for serious illness due to COVID-19, that includes both people who are 60 years old and better, and it also includes anyone of any age with underlying health conditions identified by the CDC as risk factors. And so these are a few. There are certainly others. The main idea is that people who are immunocompromised or have a condition that could cause the person to be at risk for serious illness. And so wanted to mention that because certainly a lot of people are 60 or above or 55 with comorbidities, but it could be anyone of any age. Next slide, please. And so spoke a little bit about this when I was mentioning it before, but just to mention, the way we look at set asides is by units, right? So when we say, for example, 10% set aside for youth, it isn't 10% of youth will be housed, but 10% of units will be offered to youth. There certainly are cases, especially when you think about it this from the perspective of families with children, where the units that become available may be specifically for individuals. And so for us with set asides, it's not always possible, for example, to say 2 out of the next 10 units. If the next 10 units available are SROs, they will go to individuals. So we look at this as more of a longer game, right? That over time we reach these thresholds, and that we look for opportunities to do so, particularly where the housing is more flexible. I'll use rapid rehousing as an example, where it can be for families, and perhaps a single PSH unit is designed for an individual, and that would be the case. But we'll measure these benchmarks and then share back with the community in June how we are doing, and then as a monthly basis after that. Next slide. And I think there's just, if you just go back, yeah, just one, there you go. Thank you so much. So the last piece of this is that in any prioritization planning, it really is critical to have a racial equity lens. And this leadership team in particular really takes to heart and discussed the notion that there's racism within every system. And so therefore it is within our system, within the healthcare system. And it's imperative that as we implement this prioritization plan, we account for systemic racialized inequities so that Coordinated Entry, in partnership with the community, can create and sustain access, equitable access for people of color. So the way to do that really is to review disaggregated data and to see if, for example, 78% of those known to be experiencing homelessness identify as Black or African American. Is it happening that testing, shielding, and housing takes place at a rate where 78% or more of those housed and have gone through this process do identify as Black or African American? If it were to be lower, we would need to look into what needs to be adjusted and addressed so that housing is on a path that it's equitable for all. So just wanted to make a point of that we'll be championing that and looking for, you know, the people who are being tested are predominantly people who are sheltered. The anticipation is this will move to encampments the expectation is this will be racially equitable. So it's not to say that it wouldn't, but simply that we need to really watch very closely for this and make adjustments if necessary. So that is the end of this prioritization section. And if there are questions, I'm happy to answer them. Also, I would just comment, if your thought about barriers moved your hand to the box that said coordinated entry, my email is in the chat box. I'm happy to connect. We don't wish to be a barrier, so please feel free to reach out so we can talk offline and work through it. So that we can make that the case, that we are helping you remove barriers. But if there's time, happy to take questions if there are any.
There were not any questions, Stephanie. I just confirmed that it really was you on the call, because someone thought it didn't sound like you, but we're all tired, I think, is really what the answer to that is. So I'm going to move on, though.
The sound of true exhaustion.
The sound of children at home and homeschooling. Yes.
Yes.
Many of you feel for Stephanie.
No. Many of you feel for you who also experience. Many of you feel for you.
I'm going to move back through the presentation. I think we're just about done, but there's plenty of time for questions. I think I don't even know what time it is. 8 minutes. I guess not. So I'm going to turn it over to Torlin, who I think is going to talk you through the usual determination of future topics in the next session. Torlin?
Thanks, Karen. Hello, everyone. So I wanted to share with you, there will not be a COVID-19 housing provider sharing and problem solving session next week due to our Heartland Alliance training. But if you want to learn more about the Slack channel, you can join Jonathan Beavis at this time in free conference, and I'm going to send all that information to you. Just to give you a little bit more of an idea of what the Heartland Alliance Diverse Population Training that's going to take place on the 7th. It's an all-day training on specific populations from 9 a.m. to 4 p.m. And so you have the opportunity to listen and get engaged in the whole training exercises and go to webinar, or just focus on the specific populations of interest to you. So some of you are already enrolled in this training, so we did not want to split the audience. We wanted to give everybody the opportunity to participate in that training. So for the peer sharing topic for next week, for Thursday, if you do not want to attend the Heartland Alliance Diverse Population, from 2:30 to 3:30, Jonathan Beavis from All Chicago will conduct what's called a best practices webinar for Slack. It would take place from 2:30 to 3:30 in free conference call, not in our peer sharing webinar, so not in this particular environment, but it'll be something outside. So I will send that information with the Slack registration details later today. And then just to remind you that we will reconvene on May 14th for our peer call that will take place here and go to webinar. And you will receive an email communication from myself with the May 14th topic information, description information. So I wanted to make sure I shared that with everyone. Next slide. So our next topic for the 14th is going to be on resources and assistance. And it's going to highlight resources for education, childcare, and it's going to take place once again Thursday, May the 14th from 2:30 to 3:30 p.m. So I wanted to share that. And of course, if you have any ideas about any future topics, please put it in the chat, or please feel free to email me at my All Chicago email. We like to, like I said, like to help you plan or facilitate a future session. If you're interested, please contact and reach out to me as well. And that's all I have.
Thanks, Torland. Again, the Heartland training is a great training. If you are interested in it, it was in person they did some in-person trainings last year, well attended, really well received. So if you need something to do for the day, feel free to sign up for that one. It is really worth your time. And then email us or put in the chat if you have another topic. Again, we want this to be most beneficial for you, and that can only happen if you all help us design and determine what the topics are going to be. So that's all that we have for today. Again, if you have other questions, if you have ideas for future topics, if you have feedback for us, like we're welcome, put it in the question box. We have about 5 more minutes, so I'm happy to stay on with folks until we are done. I see there was a future topic suggestion. I'll just leave that to Torlin. Okay. We'll just sit tight for a few minutes, but thank you all for attending. We know you're incredibly busy and doing incredible work out there, and we just really appreciate you joining us for this webinar and the time and attention you're putting to everything.